Hi, my name is Dr. Nicholas Sablan. I'm an orthopedic surgeon specializing in sports medicine at Tidewater Orthopedics, which is located both in Hampton and Williamsburg, Virginia. And today, because of the start of the spring, we're looking to talk about common baseball injuries as people are getting back onto the diamond. So Tommy John surgery is a surgery first performed at Curl and Joke Clinic, where I did my fellowship on a Major League Baseball pitcher named Tommy John. And what it is a reconstruction. That means replacement of a ligament on the inside, or what we call the ulnar collateral ligament of the elbow, which is a ligament that sees a lot of stress in baseball playing. So the surgery involved taking tissue, most commonly from the body. There's one place near the wrist, and then there's some people who have tried using tissue from the hamstring or in the knee region. And some people have advocated using cadaver tissue to reconstruct or replace a torn ligament that's in the inside of the elbow. So typically this is an injury that occurs in high-level baseball players, and more specifically pitchers. While we do see occasional positional players having Tommy John surgery, the vast majority involve pitchers, just because the velocity as well as the frequency with which they throw. This is not a typical injury or a requirement for more recreational type athletes. Because in the original Tommy John surgery, or the modifications that have occurred through the years, you're still taking tissue from some other part of the body or a cadaver tissue, and you're placing it in the location of where the native ulnar collateral ligament sits. And so you're requiring that piece of tissue to reform or turn into a new ligament in the elbow, which takes time biologically. So the rehab is pretty extensive. So there's an initial period of immobilization where you're not moving your arm and letting everything heal. And then there's a gradual return to range of motion of the elbow, followed by strengthening. And it's not until you complete those phases that you can begin what's called a throwing program, which is where you start throwing from a prescribed distance and a prescribed velocity at a prescribed time, and gradually working your way back, where for most people it's working your way back to the mound. And that can take, anywhere from 6 to 12 months. So the major risks associated with Tommy John surgery could be that the reconstruction doesn't take, if your body doesn't take to the injury, or if you were to re-injure it during the throwing process. There's also an important nerve called your ulnar nerve that sits right behind it that can sometimes be irritated for a period of time, even up to months after the surgery. It actually occurred with Tommy John himself when he had the original surgery. And then there's some superficial nerves that sit right around that area as well that can have irritation for the first couple months after surgery. So it most definitely can. If you look at the reason why people have Tommy John surgery, while occasionally I'll see patients who feel an actual pop when they have an acute traumatic injury, most people it's a gradual decrease in their velocity and accuracy. They feel like they just can't really put their throws together where they're used to. And there's novel treatments beyond Tommy John reconstruction that are out there. One surgery that's gaining a lot of favor now is what's called an internal bracing. Actually, Ohani for the LA Dodgers just had this procedure because he had a prior ulnar collateral ligament reconstruction. And what the surgery in that situation is involved taking these sutures that have been dipped in a collagen base to be able to allow some early healing to act like a strut or a brace to allow the native ulnar collateral ligament to heal. And for most people, that's typically done in the setting of a traumatic injury where an athlete feels a pop and has some period of time where they were feeling great, and then acutely they feel an injury happen. So the data is pretty varying out there, because what we have to understand is that there are a certain percentage of people, and that number has ranged from 2/3 to 10% of patients who aren't able to successfully return back to competitive athletics, especially at their current level, whether it be Major League Baseball players, etc. And the risk of injury, so therefore, is difficult to ascertain. But overall, it's a highly successful operation, which has over an 85% return to the same level of competition in most studies. And so if you look at those numbers, you're seeing about 10 to 15%, whether they re-rupture or they just aren't able to return back to the same level of competition. I mean, the biggest thing is common sense things in terms of warming up, getting your arm ready, not going from, sitting on the couch or playing another sport to throwing as hard as you can right off the bat. And some of the other science that's out there with regards to the prevention of shoulder and elbow injuries in baseball players involves activities like core strengthening, making sure you keep the flexibility in the shoulder, more specifically with regards to the internal rotation, which can get tightened in baseball players. And the last thing is focusing on the muscles in the back part of your shoulder called your scapular stabilizers. And while that can't erase or eliminate the possibility of ulnar collateral ligament injuries, it can greatly reduce the chance of injury. Feel free to call us at Tidewater Orthopedics, 757-827-2480, or we have a website where you can make some online appointments.